Welcome back to our nursing series. Today, we're breaking down acidosis and alkalosis, one of the most important and tricky topics for NClEX and clinical practice. Don't worry, we'll make it simple, interactive, and even fun. Remember, acid-base balance is like a seesaw. Blood pH should stay between 7.35 and 7.45. Acidosis equals pH less than 7.35, seesaw tips left, too acidic. Alkalosis equals pH over 7.45, seesaw tips right, too basic. Learning objectives. By the end of this video, you'll be able to 1. Identify the types and causes of acidosis and alkalosis. 2. Recognize signs and symptoms in patients. 3. Interpret basic ABG results for NClEX style questions. 4. Apply fun mnemonics and strategies to remember acid-base disorders. Quick analogy and visual. Think of your blood like a seesaw or balance scale. Too much acid equals pH drops. Left side down, patient may be sleepy, confused, or lethargic. Too much base equals pH rises. Right side up, patient may feel tingly, anxious, or have muscle cramps. Visual tip. Imagine red equals acid danger and blue equals base alert. This helps you remember the effects quickly. Section 2. Types and causes with fun mnemonics. A. Acidosis. 1. Metabolic acidosis, MUDPILES. Uremia, renal failure. Diabetic ketoacidosis. A propylene glycol. Air, iron, isoniazid. Acidosis. Ethylene glycol. Salicylates. Fun tip. Say it out loud. MUDPILES cause my pH to drop. Respiratory acidosis. Hyperventilation equals CO2 retention. Causes. COPD, sedation, severe pneumonia, brain injury. Mnemonic. Sleepy CO2. Patient is drowsy or confused. Alkalosis. 1. Metabolic alkalosis, vomit. Vomiting. Overuse of antacids. Mineralocorticoid excess. Iatrogenic, IV bicarbonate. Thoracic suction, NG tube. Respiratory alkalosis, hyperventilation. Causes: anxiety, pain, fever, early pulmonary embolism. Mnemonic. Alkaline activates, tingly, anxious patient. Signs and symptoms. Imbalance, early symptoms, severe symptoms. All 2020 is quite a big jump. Metabolic respiratory acidosis, fatigue, headache, drowsiness. Kussmaul respirations, hypotension, arrhythmias, coma. Metabolic respiratory alkalosis, lightheadedness, numbness, tingling, muscle cramps, tetany, seizures, hypokalemia. Look, if a patient is tingling and anxious, is it acid or base? Answer: base, alkalosis. Section 4. Easy ABG interpretation for NClEX. Step by step. 1. Check pH first. Acidotic, less than 7.35, or alkalotic, more than 7.45. 2. Check PaCO2, respiratory problem. 3. Check HCO3-, metabolic problem. 4. Look for compensation, kidneys, or lungs try to restore balance. Example: T. pH 7.25, pH CO2 40, HCO3 18, pH low, HCO3 low, metabolic acidosis. Scenario game. Show two ABG charts, pause, and ask which is respiratory, which is metabolic. Section 5. Nursing interventions. Acidosis.
So, you got the flippy doopy in your plum bob?
Metabolic. Treat cause, DKA, insulin fluids, renal failure, dialysis. Okay. Respiratory. Improve ventilation, treat lung disease. Monitor K+ and ECG, risk of arrhythmias. Alkalosis. Metabolic. Replace electrolytes, K+, Cl-, treat vomiting. Respiratory. Calm patient, breathing techniques, treat underlying cause. Monitor for tetany, muscle cramps, seizures. Ask viewers, if your patient has low K+, which acid-base imbalance are you worried about?
You got the flippy doopy in your plum bob? Let me check. Your shimmy seems a bit
Fun memory tricks. Acid always alerts, sleepy, drowsy, confused. Alkaline activates tingly, anxious, hyperactive muscles. Use hand gestures. Tilt hands left for acid, right for base. Quick review and NClEX prep. Metabolic equals HCO3, problem. Respiratory equals PaCO2, problem. pH less than 7.35, acidosis. pH greater than 7.45 is alkalosis. Compensation shows how body tries to restore balance. Watch K levels and symptoms. Scenario practice. Patient with COPD and pH 7.30, PaCO2 55. What type? Respiratory acidosis. Patient hyperventilating in panic, pH 7.50, PaCO2 28, respiratory alkalosis. Takeaways. 1. Always start with pH. 2. Use mnemonics, MUDPILES, VOMIT for causes. 3. Recognize classic signs and symptoms. 4. Use interactive ABG practice to reinforce learning. Remember, body tries to compensate, but focus on treating the underlying cause. Closing or call to action. Acid-base balance may seem complicated, but with mnemonics, scenarios, and practice, you'll master it for NClEX and clinical care. If you found this video helpful, don't forget to subscribe to our channel for more nursing tutorials, NClEX prep, and practical tips for students.
Wiggle Woo Mountain. Now it's a flibber flabber roof.